Your dog is watching you move through the kitchen. Not casually, not the way they watch a squirrel through the window. This is different. Their head tracks you from counter to refrigerator, refrigerator to sink. When you pause, they pause. When you turn, their ears shift forward. You assume it's about food, or maybe they need to go out, or they're bored and want attention. Those guesses feel right because they're simple. But in 2015, researchers at the University of Portsmouth tested this exact behavior in 84 dogs using high-speed cameras that tracked eye movement and head position. What they found had nothing to do with hunger or boredom. Your dog is reading your face for emotional information the same way a human infant does, using the same neural pathways, processing the same microexpressions. They're not waiting for something. They're studying you. Number 1. They process your emotional state before you finish processing it yourself. When you come home angry, your dog knows before you close the door. A 2018 study by Dr. Natalia Albuquerque at the University of Sao Paulo used functional MRI imaging on 17 dogs while playing recorded human vocalizations. Angry voices activated the dog's amygdala, the brain's threat detection center, within 0.3 seconds. That's faster than the human conscious recognition threshold. But here's the second layer. A companion study at the University of Vienna by Ludwig Huber tested whether dogs could distinguish between angry faces and angry voices when the two were mismatched. They could. Dogs shown a smiling face paired with an angry voice showed confusion responses, increased cortisol, and delayed approach behavior. They're not just hearing your tone. They're cross-referencing your facial expression, your body position, and your vocal pitch simultaneously. The way you would evaluate whether someone is lying. From your dog's perspective, you are constantly broadcasting emotional data, and they are constantly receiving it. What you think of as your dog sensing your mood is actually multi-layered threat assessment happening in real time. They're not empathizing in the way humans do. They're running survival calculations based on whether the most important resource in their environment, you, is safe to approach. Number 2. The clinginess isn't emotional neediness. Your dog follows you to the bathroom, lies at your feet while you work, watches the door when you leave a room. The standard interpretation is separation anxiety or excessive attachment. In 2016, researchers at Oregon State University's Human-Animal Interaction Lab tested 38 dogs in what's called the Secure Base Test, adapted from attachment research in human children. Dogs were placed in a room with their owner, then with a stranger, then alone. 73% showed what developmental psychologists call secure attachment patterns. They explored the room freely when the owner was present, showed moderate distress when alone, and sought proximity when the owner returned. That percentage is almost exactly the same proportion found in human toddlers. But what makes this profound is what it means neurologically. Attachment in mammals is regulated by oxytocin, the same hormone that bonds mothers to infants. A 2015 study by Takefumi Kikusui at Azabo University in Japan measured oxytocin levels in dogs and owners during eye contact. Both spiked. In dogs, the increase was 130% above baseline. In owners, 300%. Your dogs need to be near you isn't learned behavior or a training artifact. It's a hijacked parental bonding system that evolution repurposed. When your dog follows you room to room, their brain is processing your absence the way a 6-month-old human processes their mother leaving. The anxiety is neurochemical, not psychological. Number 3. They remember specific events you think they've forgotten. You come home and your dog greets you the same way every time. Enthusiastic, immediate, seemingly living entirely in the present moment. The assumption has always been that dogs lack episodic memory, the ability to recall specific events with temporal context. In 2016, Dr. Claudia Fugaza at Eötvös-Loránd University in Budapest tested 17 dogs using a do-as-I-do paradigm. Dogs were trained to imitate human actions, then tested on whether they could recall and reproduce an action they'd seen only once, after a delay, when they hadn't been expecting to need to remember it. They could. Even after a 1-hour delay, dogs successfully recalled and performed novel actions with 59% accuracy. That's episodic memory. But the deeper finding came in 2022, when researchers at the University of Veterinary Medicine Vienna used this same framework to test how long dogs retain memory of specific negative events. Dogs who had experienced a single startling noise in a specific location avoided that location 7 months later, even when the environment had changed. Your dog remembers the time they got stung by a bee in the backyard 3 summers ago. They remember the specific vet visit where they got the painful injection. They remember the car ride that ended at the kennel. What looks like living in the moment is actually a rich archive of specific experiences that inform every decision they make. When your dog hesitates at a doorway or refuses to go into a room, they're not being stubborn. They're accessing a catalog of past events you don't know they still carry. Number 4. The aggressive dog is often the terrified dog. A dog lunges at another dog on the street, barks aggressively at strangers approaching the house, growls when someone reaches for their food bowl. The immediate interpretation is dominance, territorialism, or aggression. In 2017, veterinary behaviorists at the University of Pennsylvania analyzed behavioral data from 4,000 dogs referred for aggression. 87% of dogs showing what owners labeled as aggressive behavior tested positive for anxiety-based fear responses when evaluated clinically. The behavior that looks like aggression is a fear reaction. But here's what makes this complicated. Dogs don't have the neurological hardware to explain their fear to you. A 2019 study using cortisol sampling found that dogs displaying barrier frustration, the behavior where they lunge at other dogs from behind a fence or on leash, showed cortisol spikes 340% above baseline 3 minutes before the visible behavior started. The aggression you see is the endpoint of an internal escalation you can't observe. From the dog's perspective, they've been screaming for 3 minutes that they're terrified and you haven't responded. So now they're escalating to the only language they have left. What you interpret as your dog protecting you or being dominant is often a dog trying to increase distance from something they perceive as a threat because they don't trust you to do it for them. The lunging isn't confidence. It's panic with teeth. Number 5. They experience physical pain they can't communicate. Your dog is moving slower, taking longer to get up, hesitating on stairs. You assume it's age, or they're tired, or maybe they're being lazy. In 2018, researchers at North Carolina State University's Comparative Pain Research Laboratory used gait analysis software and pressure-sensitive walkways to evaluate 124 dogs owners described as healthy but slowing down. 91% had measurable joint pain. 73% showed inflammation markers in blood work. These were dogs whose owners had no idea they were in pain. The issue is that dogs are neurologically wired to hide pain, an evolutionary adaptation from when showing weakness meant becoming a predator's target. A 2020 study at the University of Glasgow developed a pain scale based on facial expressions in dogs, similar to pain scales used in preverbal human infants. They identified 6 measurable facial indicators, including ear position, eye tightening, and muzzle tension. When tested on dogs with confirmed osteoarthritis, the scale had 91% accuracy in identifying pain that owners had missed. Your dog can be in chronic pain for months while you interpret their behavior as normal aging. What looks like your dog slowing down or getting picky about walks is often them trying to avoid movement that hurts. They don't whine because whining didn't evolve to communicate with humans. It evolved to signal distress to other dogs, and adult dogs suppress it. If your dog is moving differently, eating differently, or interacting differently, the first assumption should be pain, not behavior. Number 6. The licking isn't affection. Your dog licks your face, your hands, your feet when you're sitting on the couch. The universal interpretation is that this is how dogs show love, the equivalent of a kiss. In 2019, researchers at Kyoto University analyzed saliva samples from dogs immediately after licking human skin. They found elevated cortisol in 68% of samples. Cortisol is a stress hormone. The dogs were stressed while licking. A second study at the University of Bristol used behavioral coding to analyze what precedes licking behavior. 81% of licking episodes followed what researchers classified as appeasement contexts, moments where the dog was attempting to de-escalate perceived tension or signal submission. When your dog licks your face after you've raised your voice, or when you come home after being gone all day, or when a stranger is petting them, they're not expressing affection. They're performing a behavior designed to reduce threat. Licking releases endorphins in dogs, which is why it can become compulsive. But the trigger is anxiety, not love. Puppies lick their mother's mouth to stimulate regurgitation of food. Adult dogs lick higher status pack members to signal deference. When your dog licks you, they're saying, "I'm not a threat. Please don't be angry." The fact that we've interpreted this as affection says more about what we want the behavior to mean than what the behavior actually is. Some dogs do lick in contentment, but the majority of chronic licking especially of faces and hands, is stress mitigation. If your dog licks obsessively, they're not loving you harder. They're trying to manage anxiety that you're not seeing. Number 7. They understand more words than you think, but not the way you think. You say walk, and your dog runs to the door. You say treat, and they sit and stare. You assume they've learned these specific words. In 2022, researchers at Utrecht University tested border collies on object recognition using the same methodology used to test vocabulary in human toddlers. One dog, a border collie named Rico, could identify 200 distinct objects by name with 95% accuracy. But the more revealing finding was how dogs process language differently than humans. A 2020 study using fMRI at Emory University showed that dogs process familiar words in the left hemisphere of the brain, the same region humans use for language. But they process tone and intonation in the right hemisphere. When you say good dog in an angry tone, your dog's brain lights up in both hemispheres simultaneously and shows confusion patterns similar to cognitive dissonance in humans. They're receiving contradictory information. Here's what this means practically. Your dog knows more words than you think, potentially hundreds. But they're also reading your facial expression, body posture, and tone as separate channels of information. When you say, "It's okay," while tensing up at the vet, or "come here," while stepping backward, you're sending mixed signals their brain has to reconcile. They're not ignoring your words. They're trying to decide which channel of information to trust. And usually, they trust your body over your voice. If your dog isn't responding to a command they clearly know, check whether your nonverbal communication is contradicting your verbal command. Number 8. When you leave, time doesn't pass the same way. You leave for 8 hours. Come home. Your dog greets you like you've been gone for 8 years. The assumption is that dogs don't understand time, that they live entirely in the present. In 2013, Therese Wren at the Swedish University of Agricultural Sciences tested this directly by leaving dogs alone for periods ranging from 30 minutes to 4 hours, then measuring greeting intensity using a standardized behavioral coding system. Greeting intensity did increase with time, but only up to 2 hours. After 2 hours, it plateaued. Dogs greeted owners the same way at 2 hours as at 4 hours. The researchers concluded that dogs don't measure time duration the way humans do. They experience a threshold. Short absence versus long absence, not incremental time. But here's the layer that changes how you should think about this. A 2020 study at the University of Western Ontario measured cortisol in dogs left alone and found that cortisol peaked at 7 minutes after the owner left, then gradually declined. By 30 minutes, most dogs had returned to baseline stress levels. What this means is that the worst part of you leaving isn't the hours you're gone, it's the first 7 minutes. Your dog isn't suffering continuously for 8 hours. They're suffering intensely for 7 minutes, then they adapt. When you come home and your dog is ecstatic, they're not reacting to 8 hours of loneliness. They're reacting to the transition itself, the moment of your absence becoming your presence. The guilt you feel about leaving your dog all day is based on the assumption that they experience your absence the way you would. They don't. They experience the departure and the return as acute emotional events, and the middle as something closer to waiting. If you're going to be gone for 4 hours, your dog doesn't benefit from you leaving and coming back twice. That's 2 departures, which is 2 cycles of the worst 7 minutes. The next time your dog follows you from room to room, here's what's actually happening. Their oxytocin levels are rising because proximity to you triggers the same neurochemical reward as a mother holding an infant. They're monitoring your facial expressions and body language for emotional data that tells them whether their environment is safe. They're cross-referencing your current behavior against a catalog of specific past experiences they remember with temporal precision. If they're licking you, they're likely managing low-level anxiety, trying to signal that they're not a threat. If they hesitate or show avoidance, they're either in pain or recalling a specific negative event you don't know they remember. When you speak to them, their brain is processing your words, your tone, and your body posture as separate channels of information and trying to reconcile conflicts between them. And when you leave, the hardest moment for them isn't the hours alone. It's the 7 minutes after the door closes. Your dog's entire emotional and neurological landscape is oriented around you as the primary reference point for safety, bonding, threat assessment, and pain management. You're not just their owner. You're the regulatory system for their nervous system. Understanding what your dog actually experiences when they look at you, follow you, react to you, doesn't require you to change everything. It requires you to see the behaviors you've always seen through the framework of what the science shows is actually happening in their brain. If this changed how you see even one behavior in your dog, leave a comment about which one. And if you want more research-backed breakdowns of what's actually happening with your dog, subscribe, because there's a lot more where this came from.